Taking charge of your breast health is one of the most empowering steps you can take as a woman over 40. Did you know that early detection dramatically increases the chances of successfully treating breast cancer? Regular breast self exams are a simple but powerful tool to understand your body, notice changes early, and advocate for your health. Many women avoid self exams because they feel unsure, anxious, or intimidated. But learning the right technique and understanding what to look for can reduce fear and give you confidence. Today, we'll explore why breast self exams are so important after 40, how hormonal changes can affect your breast tissue, a step by step guide for an effective self exam, and when to seek professional care. As we age, our breasts naturally undergo changes. Hormonal shifts during perimenopause and menopause reduce glandular tissue, making the breast feel different than it did in your 20s or 30s. Fatty tissue gradually replaces dense tissue, which can make lumps or irregularities harder to detect without regular checks. Early detection saves lives. Finding changes early often means less invasive treatment and better outcomes. It's important to note that self-exams are not a replacement for mammograms or clinical exams, but they are a critical complement to routine screenings. Timing your self-exam can make it more comfortable and consistent. For premenopausal women, the best time is a few days after your period, when the breasts are less tender or swollen. For postmenopausal women, choose a consistent day each month to make it easier to remember. Aim for once a month. Let's walk through the steps of a proper breast self-exam. Start by standing in front of a mirror with your shoulders straight and arms on your hips. Look for any changes in size, shape, or symmetry. Notice dimpling, puckering, redness, or swelling. Then, raise your arms overhead and observe the contour, skin texture, and nipple appearance again. Next, gently check for fluid by squeezing each nipple to see if there is any discharge, whether clear, milky, or bloody. Any unusual fluid should be discussed with your doctor immediately. Now, it's time to examine your breasts while lying down. Place a pillow under your right shoulder and use the pads of the 3 middle fingers on your left hand to examine your right breast, moving in small circles from the outer edge toward the nipple. Use 3 levels of pressure: light for tissue close to the skin, medium for deeper tissue, and firm for tissue near the chest wall. Repeat on the opposite side. Many women find it helpful to also perform a standing or sitting exam, often in the shower when the skin is wet and slippery. Use the same circular motions to feel for lumps or thickened areas. While performing your exam, be on the lookout for anything unusual. Lumps or thickened areas that feel different from the rest of the breast, changes in size or shape, skin dimpling or puckering, nipple inversion, redness, or discharge, and persistent pain or tenderness in one area are all reasons to pay attention. Familiarity with your breasts is key. Knowing what feels normal for you makes it easier to notice changes. If you discover a new lump, thickening, or any change in size, shape, or appearance, contact your healthcare provider promptly. Persistent nipple changes or discharge, skin dimpling, redness, or rash should also be evaluated. Remember, most breast changes are not cancer, but early evaluation is essential for your health and peace of mind. For midlife women, there are a few additional tips to support breast health. Pair self-exams with regular mammograms as recommended by your doctor. Maintaining a healthy lifestyle, including regular exercise, balanced nutrition, limited alcohol, and avoiding smoking, supports overall breast tissue health. Tracking changes in a journal or app can help you notice patterns or new findings over time. Breast self-exams are more than a routine. They are an act of self-care, awareness, and empowerment. For women over 40, regular exams provide the confidence to catch changes early and take proactive steps for your health. At Leap 2, Better Health, we empower women 40 and older to take control of their health with practical, science-backed strategies for prevention, early detection, and overall wellness. Comment below if you do regular self-exams. Like this video if it helped you feel more confident about checking your breasts. Share it with a friend to spread awareness. And subscribe for more midlife wellness tips, guidance, and health education. Knowledge, consistency, and awareness are your best tools for protecting your health every day.